you have to study this and come up with a vaccine for this. The fascinating field of epidemiology and virology and biology. Joining us right now, a biology professor who's a virologist, has been following the coronavirus closely on a daily basis from Southern Connecticut State University. Professor Sarah Crawford joins us. Professor Paul here at WICC. How are you today?
Hi, Paul. Thank you for inviting me today. I wish it were under better circumstances.
Yeah, because, this kind of thing has always fascinated me, but, Professor, before we get down to the nuts and bolts of this, I think on a base level here, it really has, I think, thankfully, made America more in tune with people who are epidemiologists and infectious disease people and virologists like yourself. That's kind of a branch of medicine that doesn't get a lot of glory, even though it should.
That's true. For a long time, people thought that we didn't have to worry about infectious disease anymore. We had antibiotics, we had flu vaccines, we have the polio vaccine. I can remember when my mother was a child, every summer they would worry about polio, and then they would have a scare and no one could go to pools or the beach or the movies. And it was terrifying. My father was born at the time of the so-called Spanish flu. His mother contracted the Spanish flu. And he lived his whole life. You could always see when someone would sneeze across the room, he would kind of shudder a little bit, and we all thought he was kind of nuts. But we're now awakened to the fact that the study of virology, the study of viruses and infectious disease, and being in touch with what's going on in the world and what's going on in the research community is so important for all of us.
And I think, Professor, that because of the excellent work that was done, especially on things like you say, such as polio, and I had some polio touch my father's side of the family, some of my older relatives still carry the scars of it.
Mm-hmm.
Because the field has been so good at what you folks do, I think that kind of fuels unintentionally this, I hate to say it, Professor, but some of this laissez-faire attitude of, I don't have to worry about it, I don't have to social distance, this is all blown out of proportion.
Well, this is a catastrophic event worldwide that no one anticipated. Clearly, theoretically, and in movies and in certain predictive documentaries, the possibility was raised. But I think in our generation and our children's generation, we've been raised to believe that science and culture and technology can conquer anything and that we don't have to be afraid anymore. And this is the first time that as a collective society, we are sort of living in fear and just kind of reconstructing the world as it was 100 years ago in the sense of how we're responding to this. Some of the images that you see from the 1919 pandemic could be taken from what's going on in New York City today. So
Absolutely.
it's.
Now, I'm sorry, go ahead.
No, I was just going to say that it's incomprehensible in many ways, and yet we have to deal with it. We're all aware of it, and we have to make the best strategic plan. And we are positioned now in the 21st century to make better decisions and have a greater resources than 100 years ago. So we're not just stuck with field hospitals and people wearing masks. We can go ahead and be proactive and figure out what's driving all of this and eradicate it. And that's the exciting part in the world of science.
Let's step back here for some people who might not, Professor Crawford, understand the difference here. A virus, which is what we're dealing with now, versus a bacterial infection. What are the differences?
Well, the main difference is that there are viruses and bacteria that can cause very serious human diseases. There's no question about that. But the main difference is that a virus cannot survive outside a host. So right now for the SARS-2 coronavirus, we humans are the host. So if you take humans out of the equation, the virus goes away. So that really is sort of the scientific basis of all the social distancing and the precautionary measures that are being taken for spread. If you prevent spread, you eliminate the virus. It's that simple. Now, you'll never be able to do that completely. These viruses are insidious. It's been called the invisible enemy. This virus obviously is more mutable than most bacteria. We certainly have antibiotic-resistant strains of bacteria, but some viruses have a genome called RNA that allows them to mutate very rapidly and to choose new hosts very rapidly. And that's what we're dealing with now, an emerging virus that has very quickly jumped from the animal population to the human population, and in many ways has been unpredictable.
When, Professor, you first heard word of this coming out of China, and it didn't make headlines right away. It was one of those kind of, as we say in the news business, with a newspaper analogy, a below-the-fold story or a sidebar story. I had a couple of infectious disease folks on who said, hey, we have to watch this closely, because obviously that, piqued their curiosity, piqued mine. What was the reaction when you first heard that this was coming out of China and reports out of China about this?
Well, I've been following it very closely since it first manifested itself out of Wuhan in January. And I was following it, for purposes of interest and certainly research purposes. But I think early on, most people thought it was going to be a recapitulation of SARS-1. That it would have sort of a limited spread, that this was, one of those things that happens periodically and it'll sort of go away. And there was no way that anyone could have known in the very earliest days that this was going to be so tremendously infectious and spread so readily, much more readily than the first SARS. So I think all of us were caught off guard in that respect. So I've been following it closely, but until things really started to go into quarantine in Wuhan in late January, that I personally, as a scientist, became alarmed that this is something that's very, very serious. And obviously, that has happened.
When you look at all the things now, Professor, that are coming out of China, allegations left and right, a lot of finger pointing going on. In fact, there's a Bloomberg story I'm looking at in front of me right now that China apparently concealed the extent of the virus outbreak. That's a story broke today. That's according to U.S. intelligence officials. Surprised about that, or would you think there was an effort to try and keep a lid on this, not to cause mass panic? What do you think was at play here? And would it have been better had we known a week or two or three beforehand, if we could have?
Well, that's a very good question. It's actually a political question to some degree. We know that China has a restricted system, and it's hard to know what's being concealed, if it is indeed being concealed. But based on their history and based on some of the facts that are sort of leaking out over time, I think that, yes, clearly in the beginning, I think most people would agree there was an effort to, conceal what was going on. You see what happened to the first doctor that tried to engage the government in this area. And it continues. There are people even today who are being suppressed because they're claiming that the death rate and the infectious disease rate continues to go up. So I think we have to deal with that reality. On the other hand, would we have been able to do anything different had we known sooner what was going to happen? And this is hugely controversial area. I'm only going to address it from a scientific point of view, and that is, regardless of the precautions that you take, unless a virus is in a community, in a population, there's nothing to do yet. So before it hit America, there was no virus. So there was no point in social quarantining and all of this. But once it hit, obviously that becomes a serious issue. And unfortunately, when this happens, the early incubation phase, where even if the virus is spreading exponentially, there are so few people affected that it doesn't garner national attention. It's only when the numbers become large enough that it becomes obvious that something very serious is going on, that we then become aware that this is a very tragic and threatening situation. And that's where we are now.
Biology professor Sarah Crawford, Southern Connecticut State University. She's a virologist also who is following the coronavirus. Professor, hang on if you can. We'll do a quick
Sure.
break here, come back, and do one more fascinating segment with, once again, Professor Sarah Crawford. This is coming up right after this as we continue. It's 1:41 on a midweek Wednesday, Connecticut Today.
Braxton was diagnosed with choroid plexus carcinoma, a brain tumor. St. Jude is helping us put away our fears. We have an amazing team that fights for the best outcome for Braxton. He has the best chance here. I don't have to worry that how much is that bag of fluid going to cost me? Can I afford it to save my child's life? The donations, they're paying for me to live every day with my son, be stress-free, and enjoy every day with him. I wish there was a word bigger than thank you, more close to the heart, because thank you is not enough. They've given me hope. They've given me my son.
St. Jude Children's Research Hospital. Finding cures. Saving children. Learn more at stjude.org. 1 in 3 adults in America have prediabetes, but most don't know it. To let people know it can be reversed before it becomes type 2 diabetes, professional basketball player Julius Randle is doing everything in reverse.
I'm only dunking with reverse windows. I drove the whole way to practice in reverse. I don't recommend it. This one's called the reverse shuffle. I do recommend it. And it took me months to learn how to speak in reverse, like this. Years 10 almost for diabetes type 2 with living then has my mind. In other words, my mom has been living with type 2 diabetes for almost 10 years. So together, we want to say to the 84 million Americans at risk, exercise and healthy eating can help reverse prediabetes. Start by taking a simple 1-minute risk test at doihaveprediabetes.org.
Brought to you by the Ad Council and its Prediabetes Awareness Partners.
Now you can't say that in reverse.
Paul Pincelli is a man of few words.
Right. More like all the words.
Connecticut Today with Paul Pincelli, WICC 600.
As we try to get you inside the nuts and bolts of the coronavirus, Professor Sarah Crawford joins us, biology professor from Southern Connecticut State University. She's also a Professor Crawford, as you have seen the numbers and discussed this with professionals in your field, what one or two things about this maybe has caused you to sit back and go, oh, wow, you know what I mean about this?
Well, I think first of all, it's transmissibility. It is highly infectious, as you've heard. They talk about it all the time on the daily briefings. You can see the trajectory increasing and accelerating at a very steep rate because of this. So it's very easy to contract, and that's because of the fact that the virus is spread through the aerosol, through touching objects. So that's one very significant and important fact about the virus, and also about its capacity to cause very significant complications in approximately 20% of the population. So here we see more than a flu. So many people have said in the beginning, especially, we deal with the flu. What are you worried about? This is not the flu. This virus is unrelated to the flu virus, first of all. The only thing it has in common is that it infects the same part of the body, which is the respiratory tract. But it can cause complete shutdown of the the lung system. And there's even a small bit of evidence that it might affect, in certain individuals, a part of the brain that controls breathing and respiration. And that might be why some people shut down automatically and die very quickly. So this is a virus whose territory is uncharted. We know it's highly contagious. We know that it can have very serious and unpredictable trajectory within an infected individual. And so this is something that is very alarming. But on the other hand, we have some wonderful testing that's going on. We have the development of incredibly sophisticated kits for identification of infected individuals. We have some experimental therapeutics that are currently being employed. And we're having a fast rate development of vaccines. So I think it's causing the whole community, the scientific community and the public health community to come together and say, how can we streamline healthcare and treatment and prevention. And I think there's going to be a wonderful outcome at the end, although there's so much suffering and pain that's going on right now. I think the wonderful outcome will be that we will have a much more effective and successful healthcare system with implications worldwide to treating and preventing these infectious diseases.
One thing I know that must just, frighten people on the front lines of this, Professor Crawford, is the fact that we keep hearing, as dire as it can be for some people, as you just illustrated for us, you keep hearing this number that 75, 80, 85% of people who carry it may have mild or no symptoms at all. And like you said, it's not the flu. When you have the flu, you know you have the flu, and you stay home. And it's frightening that a lot of people could just be walking around with a mild sniffle, or even something, and not know it.
Yes, that's true. I mean, it seems like the virus has two phases, actually. It infects the body, and then the innate immune system responds. And if the innate immune system responds well, the individual may never even know they're sick, but they still have virus in their body. They're still shedding the virus. So that's stage one, and many people resolve after that stage. But then you have individuals in which the innate immune system isn't so capable of fighting off the virus. So it goes into a more systemic situation, further infection, and you're waiting for the immune system to completely recognize that virus and destroy it. So that takes a lot longer, and the infection can become a lot more embedded within the lungs and other tissues within the body. So we have this dichotomy of early versus late stage infection. Both are transmissible, but certainly the scary part is that some people may not even know, because they're asymptomatic, that they're infected, but they can actually transmit the disease. And that's why I think it's so important that we do surveillance testing. I think we are developing the technology now to test people generally within the populations and determine who's infected, who's not. Those who are not infected can go about their daily business, because we want to get back to the real world. We want this surreal existence to end, but it won't end unless we're willing to take the bull by the horn, so to speak, and test everybody who wants to go back to work, who wants to mix in the public arena, and do that testing on a fairly regular basis until finally this virus works through the population, you develop herd immunity, and there's so little transmission that we're not seeing these incidence and death rates that we're seeing now as the virus is actually ramping up and escalating through the human population in America.
Absolutely.
And other places, of course.
Professor, do you see this, when this is all said and done, if a working vaccine is found, is that, do you think, possibly going to become part of our yearly regime? Oh, did you get your flu shot? Oh, it's out. Hey, this year's coronavirus vaccine is out. Do you think that would just be a one-time thing maybe, or will that be now an annual or maybe every few years kind of shot? What do you think?
Well, that's a very good question. Right now, given the virus and the way it's behaving, you would say, well, it's a one-shot deal. You activate your immune system, you're immune to the virus. It would depend upon the ability of the virus to continue to mutate into different forms. And that's what the flu virus does. But the flu virus has a very well-known trajectory through the avian system and through pigs and through humans that tends to be somewhat seasonal. It's a very different virus. It evolves very differently. So the flu virus, actually, based on its genome, is much more capable of changing very dramatically than this virus. So I would expect this virus to accumulate very small changes, because that's the way it's built. And those small changes can affect its infectivity and resistance and susceptibility. But I don't think it's going to be nearly so dramatic as that of the flu virus. So I'm thinking that a vaccine that would be developed, especially if it's universally applied, would have a good protection and not require subsequent vaccination unless we see that there is a shelf life to the vaccine in terms of long-term resistance to infection. But if we can bring the infection down, we certainly have identified the source, and if we can basically bring it down within the spread within the human population, I think for certainly the next few years, a single vaccine should be sufficient. to prevent the spread of the virus.
Fascinating stuff. Biology professor Sarah Crawford, Southern Connecticut State University. She's also a virologist professor. Thank you so much. This has been intriguing, and hopefully we can have you back in the future. Thank you for your time.
Thank you so much, and I hope everybody stays safe and we can talk on much happier terms someday soon.
We'll have you back soon. Thank you, Professor.